adult transthoracic echocardiography uses frequencies in the range of A 1 to 2 MHz, B 2.5 to 5 MHz, C 5.5 to 6.5 MHz, D 7 to 10 MHz. Correct answer B 2.5 to 5 MHz. Higher frequency like 7 to 10 MHz can be used in pediatric imaging and in transesophageal echocardiography. Higher frequencies give better resolution, but penetration is poor. In an adult where the cardiac structures are at a higher distance for transthoracic echocardiography, lower frequency is preferred. In infants, cardiac structures are nearer and smaller, making 7 to 10 MHz better for resolution. And imaging is possible because of the shorter distance involved. Same applies to transesophageal echocardiography, where heart is just in front of the esophagus. Modern broadband transducers allow us to change frequency with the same probe. Doppler echocardiography is best done with the ultrasound beam A parallel to the direction of blood flow, B perpendicular to the direction of blood flow, C at an angle of 45 degrees to the direction of blood flow, D at an angle of 135 degrees to the direction of blood flow. Correct answer A parallel to the direction of blood flow. While two-dimensional imaging gives better view if the structure being imaged is perpendicular to the beam direction, Doppler estimates the velocity of moving red blood cells best when the direction of beam is parallel to the direction of blood flow. This can be stated as zero angle of insonation for optimal results. Slight angulations can be taken care of by angle correction algorithms in the machine. But if the angle is more than 20 degrees, high errors may give unphysiological values with angle correction. The ultrasound reflected from red blood cells moving away from the transducer has A. higher frequency and is color coded red, B. higher frequency and color coded blue, C. lower frequency and color coded red, D. lower frequency and color coded blue. Correct answer D. lower frequency and color coded blue. Ultrasound reflected from red blood cells moving towards the transducer will be perceived as having higher frequency. By notation, in color Doppler imaging, they are given red color. In pulsed wave and continuous wave Doppler, they are depicted above the baseline. Signals reflected from red blood cells moving away from the transducer are perceived as having lower frequency and depicted in blue color on color Doppler and below the baseline in pulsed wave and continuous wave Doppler. Bernoulli equation for calculation of pressure gradient by Doppler echocardiography is A. P is equal to 2V squared, B. P is equal to 3V squared, C. P is equal to 4V squared, D. P is equal to 4V cubed. Correct answer C. P is equal to 4V squared. Original Bernoulli equation is a complex equation. This is a simplified equation routinely used in Doppler echocardiography for pressure gradient across walls while quantifying severity of stenosis. In simplified equation, only the distal velocity is taken into consideration. Velocity proximal to the stenosis being much smaller is ignored. Similarly, factors for flow acceleration and viscous friction are also not taken into consideration, being smaller values. In the simplified Bernoulli equation, P is the pressure gradient and V is the distal velocity measured by Doppler echocardiography. In modern machines, we do not need to calculate by the equation. The computer program calculates it automatically. Relation of Nyquist limit to pulse repetition frequency PRF. A. Nyquist limit is half the pulse repetition frequency. B. Nyquist limit is twice the pulse repetition frequency. C. Nyquist limit is 3 times the pulse repetition frequency. D. Nyquist limit is 1/3 of the pulse repetition frequency. Correct answer A. Nyquist limit is half the pulse repetition frequency. Nyquist limit is the maximum velocity of blood flow that can be estimated by pulse Doppler. It can be increased by increasing the pulse repetition frequency of the machine until the physical limit is reached. If the velocity is higher, the spectrum display will appear to wrap around or alias. That is, a signal which has to be shown above the baseline will be shown partly above the baseline and remaining part below the baseline. Most common method of assessment of pulmonary hypertension by Doppler echocardiography is by using A. Forward velocity across the tricuspid valve. B. Reverse velocity across the tricuspid valve. C. Forward velocity across the pulmonary valve. D. Reverse velocity across the mitral valve. Correct answer B. Reverse velocity across the tricuspid valve. Reverse velocity across the tricuspid valve is that due to tricuspid regurgitation. Bernoulli equation P equal to 4V squared gives the gradient of tricuspid regurgitation flow, which corresponds to the pressure difference between right ventricle and right atrium in systole. If a nominal right atrial pressure of 10 millimeters of mercury is added to it, right ventricular pressure and indirectly the pulmonary artery systolic pressure are obtained in the absence of pulmonary stenosis. If there is high right atrial pressure with elevated jugular venous pressure, 15 or 20 millimeters of mercury may have to be added instead of 10 millimeters of mercury. The early diastolic pulmonary regurgitation PR gradient, peak PR gradient, will give an estimate of mean pulmonary artery pressure. End diastolic gradient of PR will give an estimate of pulmonary artery end diastolic pressure, Ideally, the right ventricular end diastolic pressure has to be added to the end diastolic PR gradient to get the pulmonary artery diastolic pressure.